thanks for staying with us. Patches is a fantastic organization that the city works with from time to time. They support kids in our community, sick kids. They do so much to help them out during the daytime. And to talk to us about that organization and about some fundraising and toy drives coming up are two people from Patches. We have Gail Stewart and also Diana Gonzalez. Thank you both for joining us today.
Thank you.
Taking a little time out to come and tell us about the great work going on out there and the important needs out there. So we'll start off with Gail. You are the nursing coordinator out there today?
I'm the Fort Pierce Administrator and Director of Nursing.
Okay. So Patches, what is Patches? I know it stands for something. What is the organization?
It stands for Pediatric Alternative Treatment Care Housing Evaluation Services.
Okay.
It is a nursing facility. We provide services for children birth to 21 years old. They are medically fragile, medically complex. We have a lot of genetic disorders, chromosomal disorders, cerebral palsy, premature babies. Some of our children have cardiac disorders, respiratory problems. They come to our center to free their parents up to be able to work, to be able to go back to school, further their education. We're open for 12 hours a day, 6 to 6, Monday through Friday.
Okay, so the kids don't stay there at night?
No, they go home with their family at night. It's not a hospital. It's a day nursing facility.
Okay. So if you have a really ill kid, a really sick kid, I'm not talking about temporary having a cold or the flu, but a kid with maybe cerebral palsy or something like that, one of these conditions you mentioned, you can bring the child there during the daytime for the attention and nursing care that they would need?
Correct.
Okay.
They'll receive nursing care, their medications, any treatments, dressing changes, IVs that they need to have. And we have a respiratory therapist on staff all day, and we also have physical therapy, occupational therapy, and speech therapy. We primarily have RNs, we have LPNs and CNAs. Also, we have Medicaid transport for the families that do not have transportation to bring their children in. We, through community transit, provide escorts, which are EMTs and CNAs, to pick up the children and bring them into the center.
CNA stands for?
Certified Nursing Assistant.
Okay. And what is your location? You serve Port St. Lucie, but you are located in Fort Pierce. Where?
We are at the old Orange Blossom Mall, the Orange Blossom Business Center, right where the school board is. We have a nice big spot there. We have a little fenced-in playground for the children. We can take them outside. We have a wheelchair swing on the way, and it's a nice place for them. These children aren't able to go to regular school, or obviously not a daycare, and it provides them the socialization that they wouldn't get at home. That's fantastic for them.
Let them be with other kids.
Their growth is just phenomenal when they have that socialization, the interaction with other children.
Do you find that helps their healing and recovery, or their therapy, that they're
most definitely
feeling connected to a group of other kids?
Most definitely. You can just see them. They'll come in. So, some of them, depending on their conditions, they'll be withdrawn, or they don't really know how to interact with a lot of people, and within a couple of weeks they're laughing, they're playing, they're interacting with the staff and other kids. It's just like day and night.
Okay. So Diana Gonzalez, you also work out there at Patches. You're not involved in the nursing end, you're involved in the administrative, I guess, some of the fundraising efforts and that kind of thing?
Marketing and fundraising for Patches. Being that Patches is a 501c3 nonprofit organization, my work mainly is to get the word out to the community, and also to be able to let the community know that we are there and that we do also need help. By help, meaning we do fundraising events. We have a way through our website that people can donate.
What is your primary source of funding? This has got to be expensive to provide that level of care. Medicaid. And there's so many changes going on in the whole national health care debate.
But we also do take children that, if they do not have insurance, we do not turn them away. We do accept those children. So that's where our goal is, to get more funding, donations and so forth to be able to afford those other children that come in with no coverage.
Right. It would be so hard to turn a kid away.
We do not turn any children away.
We don't. And the Medicaid isn't Medicaid funding, it's a fee for service. We provide the service, and it's a fee for service based. It's not a group funding from Medicaid. Some of the children aren't totally on Medicaid. If their parents have insurance, they're on insurance. They have private insurance. Some of them have Medicaid as a secondary. Private insurance is fantastic for a healthy child. It is not for one of our children. The services that are covered typically are maybe 20 therapy visits a year. Our kids get that in a week.
Wow.
Or more than that in a week. So we will take them in and at no charge to the parents.
That's fantastic that there's got to be some place like this that people can turn to. One of the things you were talking about, the socialization, I know you're looking at maybe a summer toy drive. Diana, can you tell us a little bit about what that might be all about?
Yeah.
You're working with City Councilman Ron Bowen here.
Yes, he has been amazing. We met last year in December because our toys were stolen, and the mayor and himself took it upon themselves to collect some toys and showed up at our center and brought these to our kids.
That's right. And those toys came largely from city employees.
From the city employees, yes.
Right.
So we've kept in touch since then, and he's had a thought of being able to help our children instead of waiting for Christmas to do something for them now in July. Being that some of our children might not be around for Christmas due to their health or due to many other situations. You know, and we always need stuff for their birthdays. We need, there's a lot of need for the kids.
Kids don't just need toys one day a year.
No, and especially our children. We're getting new children all the time. We have 43 children.
43 children now, with approximately 5 or 6 that are being admitted.
And we can go up to 85, so we constantly will have.
Right, and I guess your census or population, whatever you call it there, kind of probably increases and decreases periodically, so you never really know exactly what you're going to have?
No, we never really know exactly what we have. We do have 43 now. Probably 98% of our children are from St. Lucie County. Right. We do service the surrounding areas, the surrounding counties. However, the transportation's an issue for the parents. So right now, 98% of our children are from St. Lucie County.
So getting them in there every day has got to be a challenge as well. You may have kids with special equipment and oxygen and all that.
We have EMTs and nursing assistants that go on the bus. They carry their oxygen. They have, they call it a jump bag. It's like a big duffel bag type thing with equipment that they have to bring with them on the bus in case that there's a problem, with the children.
So you have your own bus?
No, we have Community Transit right now has a bus. They have 2 buses that they utilize for pick up and drop off of our children. We provide the escorts for those buses.
Okay. And then every day you're open early. Do kids come in some earlier and some later? How does that work?
They stagger. The earliest is usually there at 6:05, 6:10, and the latest is picked up at 5:55, 6 o'clock.
Long day.
And yeah, it is. It varies. If the parents work different hours, some of them might get there at 8 or 9 or 7. Depends on the parents' work schedule.
Right. Diana, Councilman Bowen was talking about how much it affects your heart. You walk in there and you see these kids. Do you find that people make that connection? Do they realize that when they come in and they see for themselves? People who maybe
everyone has to come and step in. And we definitely would love to do some tours. All they do is have to give me a call, and I'll make that happen so that they can come and see what happens and see what our needs are and where we're at and what we provide for the children, because you have to see it day by day.
Sure.
And understand it.
Give us that phone number that if somebody does want to give you a call, take you up on your offer.
Sure, 772-462-6601.
Okay, that's good to know. What else do you have? You're in your new place here that you're in now. What are your longer-term plans for the organization? You have just to keep at it every day, keep plugging away?
Keep at it every day to bring in as many children as have needs. We would like to be able to take in everybody that needs our services, and of course expand and hopefully find a program for adolescents at now, the way it stands for our children up to 21, you know, we service, but there's that group from 21 to probably, I think it's 65, before you can get into an elderly service, that there's not a lot of services available for those people. So that's kind of out there for the long term to look into.
Sure. It's a little hard, I know, because of so many things going on with national health care. You're not certain of your funding for the future, and that's so hard to accept that kids this needy you don't have a guarantee. We know we're going to have this level of funding next year. It's going to be provided.
No.
It's a little hard to accept and understand why that is. So I know your role, Diana, particularly going out there trying to spread the word, let people know, getting people to help out, make contribution if they can.
Yes, definitely.
That's particularly important.
Yep.
When people do get involved out there, I'm sure they've got to really feel good that they've helped out.
Yep.
It's got to be a good feeling for
And they're
them.
more than welcome to always come and see the kids.
And how about for parents who didn't know this existed the first time when they realized there is a good organization with good trained quality professional help that can help them out during the day? What's the response that you get from them?
They're just so grateful and appreciative that they have found us. Most of our parents are there a lot. They get involved in any of the activities. We have activities that we have coming up. We try to do holiday special things for the children, and the parents get involved with that. They're just very happy that they have a safe place for their child that is interacting socially, and to see them happy and thrive so that they can go to work and provide for the family like they need to.
And the stress that a parent must feel when they can't find a place, or when they first leave a kid and they're not sure what to expect. I'm sure you must be experienced in dealing with that.
They're very nervous when they drop their child off the first time, even though they come in and they meet everybody and they have a tour. And they'll call, and they can call anytime to check on them, but usually by the second day, third day, they don't call quite as much. They're very comfortable with the staff. When they bring their child in, for the most part, they're happy to be there. Then it's not like, you know, you take your kid to a daycare and drop them off and they're kicking and screaming when you leave. They don't really do that. They're happy. They run off to their friends, you know, yeah.
Good.
It's just a wonderful place for them to be.
Well, that's great. City employees were very happy last year to get involved and contribute. Many of them hadn't heard of Patches, and when they found out what this was, they jumped right on board and said, yeah, this is a cause we got to be involved in. So we're looking forward to your summer toy drive again. Yeah, the kids will need the toys all year long.
Yes, they do.
Great point. And it's good to have you both here. Appreciate you taking some time to tell us about the organization, spread the word a little bit, let people know about the good work you do out there. Excuse me. Gail Stewart and Diana Gonzalez, thank you both very much for your time. Give us the phone number one more time before we break.
772-462-6601.
Well, great. Maybe we'll get some people to give you a call and help out.
Thank you.
Thank you both.
Thank you.
Appreciate it. And we'll be back after this quick message.